Hello, everyone. Happy Wednesday and welcome to the latest edition of the Cosmetic Laser Dermatology webinar series. I'm very excited for today's webinar. We're here today with the esteemed Dr. Sabrina Fabi. Hi, Dr. Fabi.
Hi, everyone.
And Dr. Fabi has an incredible talk planned for you all. So I hope you're all ready. Get your glass of wine or your water or whatever it is and sit back, relax, and get ready to learn a ton. Today, she's going to be focusing on retaining your feminine beauty or your masculine charm with anti-aging aesthetic treatments. Basically, as we age, the female face becomes more masculine appearing and the male face becomes more amorphous. And the goal of many anti-aging treatments is to not just make people look younger, but actually more attractive. So Dr. Fabi is going to talk about what procedures both men and women can embark on to retain their feminine and masculine looks while avoiding some of the pitfalls that we see when people don't look natural. So I see a lot of you joining and tuning in. Welcome. Dr. Fabi is going to begin in about 1 minute. Until then, we will have time for Q&A at the end of the talk. So please use the Q&A feature on your Zoom platform. If you're calling in, you're welcome to put it in the chat feature and I'll make sure we get to it. Otherwise, thank you so much for joining. For those of you that just came on, you're joining the webinar with Dr. Sabrina Fabi today on retaining your feminine beauty or masculine charm with anti-aging aesthetic treatments.
Thank you so much, Risa. And the reason that we're giving this tonight is because there have been a lot of trends that have surfaced where people are getting a very snatched jawline, but sometimes the jawline can be injected in a woman in such a way that it squares her off and can make her look more masculine. Now, some women do want to appear more masculine, but others, for the most part, at least those that join and come to my practice, want to really preserve the femininity of their female face. And so for that kind of patient, that's where this talk is intended to address. Just like for many men, they see a lot of people embarking on neuromodulator treatments with either Botox, Dysport, or Xeomin, and they see these peaked eyebrows that make them look a little more quizzical and even a bit feminine, and that's sometimes an apprehension in them embarking on the aesthetic procedures. And so to demystify that these procedures may actually make you look more like a woman if you're a man or a man if you're a woman, we decided to talk about why this even happens, what to look out for, and how to prevent it.
Great. So I have a feeling most of you know Dr. Fabi because you're here, but just in case you don't, she's a board certified dermatologist practicing in San Diego, California at Cosmetic Laser Dermatology. She is very much world renowned for all types of cosmetic dermatology treatments, from injectables to lasers to body sculpting. She teaches many of her peers, dermatologists, and other surgeons about her techniques. She sees tons of patients and the results are astounding. If you just follow her or the practice on social media, you'll see the pictures often. And I'm very grateful that she took the time to put together this talk today, and I hope you all enjoy it. We are recording it, so we will email this to everyone, so you can always look back and watch it later. So without further ado, Dr. Fabi, all you.
So just to get a lay of the land and know what your needs are from tonight's lecture, we'd like to ask you a couple of questions. So Risa, maybe you can do a little poll.
Perfect. It is up on the screen. So the first one, what is your age? That's pretty easy. What cosmetic or laser procedures have you had before? And what's the biggest takeaway you're looking for from today's webinar?
And you can click on multiple if you've had multiple of these procedures before. I feel like we should be giving you music.
I know.
Sorry.
All right. 5 more seconds. All right. Last time. Okay, here we go. So let me share the results.
Great. So the majority of you are between the ages of 46 and 60. So many of the procedures I will cover will address that. And then followed by 61 and over, and then 31 to 45. Wonderful. The majority of you have had Botox, but it looks like the rest of you have already done laser procedures and fillers. So you're probably established patients of our practice. Wonderful. Next.
And then if you scroll down, what's the biggest takeaway you want? Most people said to learn about new procedures.
Okay, awesome. So we'll talk about new procedures and how you can customize them to achieve a more feminine looking appearance or a more masculine looking appearance. And we know that I published on this, that many times we believe that we embark on these aesthetic treatments just to look younger. But in fact, we are now learning that these aesthetic procedures do have a correlation with also making us look more attractive. And that's directly correlated if you make the person look more feminine if they're a woman, or more masculine if they're a male. And that study was just recently published. We did one of the largest studies of its kind, actually polling the layperson over 9 different cities, over 3,000 people. If you are interested in that study, I actually just posted on it both on Instagram and LinkedIn. And so there is science to support that these should be the ideal parameters that we're trying to achieve. And that's why we're talking about this. Now, of course, if you are a woman trying to look more masculine, that's absolutely appropriate if that is your choice. But I'm just giving you and reporting on the data and the type of patient that comes into my office requesting to look more attractive. And so we published on this. This was another study that I had published on about 2 years ago, which is, what are we truly trying to achieve? Sometimes in an attempt to try to look too young, people actually end up looking a little unnatural and lose their attractiveness. And so it shouldn't necessarily be just about looking younger. That's like a secondary endpoint. It's sometimes just about looking more attractive, whether you're a man or you're a woman. So we have to talk about aesthetic ideals if we're going to be talking about making people look more feminine or more masculine. When we look at femininity and who are considered the most beautiful women in the world, you see Bella Hadid, and then you see Beyonce. And the takeaways from this publication that came out, I want to say about 1.5 years ago, is if you look, what makes them attractive? Well, look at their temples first. So I like to start from the top down, and this is how I assess a face. First, they both have full heads of hair. You don't see any temporal thinning, which is something that we start to see in women as well as men. You see them with a nice, thick, dense hair all throughout the hairline. The next thing is that you see that their temples go in just a little bit, with the most prominent feature being the width of the cheek. And so I see a lot of women sometimes coming in just with these temples that are wider than their cheek. And that in fact actually makes you look a bit more masculine. And if you look at them, their jawline goes in a little bit more than their cheek. So the width of the cheek is the most widest point on the female face. If you also look, the point of their chin is about the distance between both inner aspects of the eye. It's not wide like the width of the entire mouth. If it were as wide as the entire mouth, they would look more masculine. Both of these women have pretty even skin, although you can see with Bella, she has a little bit of pigmentation, but overall, they both have a nice glow to their skin. Their lips are fuller, but they're not sticking out of proportion to their nose or their chin, which would make them look more like a duck, which then would make them look unnatural, which we know is associated with looking less attractive based on that study that I talked about. Their brows are nice and arched. And so I'm calling out all of these features because these are all things that make a composite. And this is ultimately what makes someone look more attractive. And so when we look at a man, Tom Cruise was considered the most attractive man last year. And then this was one of on the further right, I don't know his name, but he was considered also one of the top 10 most attractive men. It was interesting when I looked at these photos. For the men, they incorporated a lot of body photos. So that tells us that that's something, although we know that for women, their body obviously contributes to a more feminine silhouette and can make them more attractive. For men, this is kind of at the forefront of what also makes them attractive, which is probably the reason why we see a lot of men coming in for body procedures, probably as equally as facial procedures, where this may not be the necessary case with women. Now, if we look at Tom Cruise, and of course, these people were not voted by me as the most or least attractive in the world. You can find this on Google if you searched for it. And so let's look at Tom Cruise. The width of his temple is about the same width of his cheek, which is about the same width as his jaw. So the temple is typically an area where we may put more product in for a man than we would put in for a woman. In a woman, just because you can doesn't mean you should. So just because you can widen her face doesn't mean you should. Just because you can put more stuff in her temples doesn't mean you should. In a man here, it's all about 1 to 1 to 1. If you look at his chin on the image to the left, you can see that it's wider. It's the width of his mouth. And so that has actually been correlated to being perceived as more successful, more confident. And you can also see that his lips don't project out as much or are not as full as his female counterparts. When you look at his forehead, you can see that he does have a pretty nice hairline, also a lot of hair, dense hair. It's a little thinner than a woman. You can also see that he has more lines in his forehead. So in the women, you saw more light reflection coming off of their forehead that made them, their skin look smoother, and perhaps they get more neuromodulator or botox treatments to smoothen out those lines. In a man, we're not looking for a complete frozen forehead if you are looking for a more masculine appearance. If you're a man and you want a more feminine appearance, that's absolutely appropriate. But for the purposes of a masculine looking appearance, having some lines and wrinkles and having that skin look a little rougher is and has been considered more masculine. If we look at his cheeks, they don't have as much light reflection out here laterally. You can actually see that they're a little bit more medial than what we see with women. So just subtle variations that we have to consider when we're talking about masculinizing and feminizing the man and the woman. If you look at his brows, look at how they're a bit lower and look at how they almost sit horizontally, even the model to the right. His brows are lower and in his, they are almost a bit downturned. So with that, now that we've kind of talked about the aesthetic ideals, looking at who the world considers the most beautiful woman and the most handsome man, I'm going to ask you just some poll questions before we get into the procedures that can be done to basically accomplish these results. Risa?
Perfect. So here we go. So for a masculine look, it is most ideal if the width of the jaw is wider than the cheeks, narrower than the cheeks, or the same size as the cheeks. And for a feminine look, it is most ideal if the width of the chin is wider than the mouth, narrower than the mouth, or the same size as the mouth. If you are all like me trying to look at yourselves in the Zoom right now and figure this out. I'll give you guys a few more seconds to vote. All right, turning it off in 2 seconds, press submit. All right, here we go.
All right, so yes, most of you were listening, and the masculine look, if you're striving for an ideal. Now, of course, these are ideals. That does not mean that they are set in stone and that everyone's going to have them. Sometimes that's the goal of these aesthetic procedures. The width of the jaw should be about the width of the cheeks, where in a woman, the width of the jaw can be narrower than the width of the cheeks. For a feminine look, it is most ideal if the width of the chin is narrower than the width of the mouth. So the majority of you got that. So thank you for listening. We're gonna go ahead and move on. So let's start with the eyes. Since I told you I kind of work my way from the upper face down. And the reason I start with the eyes is because we know that there are three factors when someone looks at you that in a first impression will basically tell them how old you are. And one of them is actually the graying of hair. If someone has gray hair, that automatically in first impression studies has been shown to make someone look older. The second is the distance between the nose and the mouth. And the third are actually the wrinkles around the eyes. So the eyes are a big component to overall first impressions of ourselves and of others with how old we look. And so that's why it's very important, because when you look at studies that track eye movement in first impressions, so there are great behavioral psychologists that actually have participated in some of this work. They can see where our eye goes to when we look at someone. And generally, the first place our eye goes to when we see somebody is their eyes. Then it tracks down to their mouth. And so that's the reason why people are bothered and spend time and money in the overall appearance of their eyes and everything that's around their eyes. And so it's important to know, again, aesthetic ideals and what can be done. So this is a gentleman that came in. He's got typical masculine brow that makes him look serious, more masculine. It's horizontal in its orientation. And so in someone like this, generally forehead lifts are very tough in men, especially because of a more receding hairline. What could he do to improve this? And so this is the type of patient where therapy is an excellent procedure. It's an ultrasound modality that takes about 15 minutes to perform if you're doing it just around the eyes. For men, it's a very popular procedure because there's no downtime, as it is for women as well. There's no scars, there's no cuts. Ultrasound energy basically causes little microscopic wounds at the level of the muscle and fascia, as well as at the skin, to lift the brow. And in the clinical trials, it showed to lift the brow about 2 millimeters. The results start to show at 3 months, become significant at that time, and last, now we know, for at least a year. And so for him, opening up his brow showed more lid, made him look a little bit more welcoming and not as serious, but still preserved the orientation of his brow so that he doesn't look more feminine. Again, now not all men have that more horizontally oriented brow. And so some have a more comma-shaped brow, but again, it's all about how we treat this man. If we positioned the treatment in a way that accentuated his comma-shaped brow, it wouldn't look as attractive. But again, just by treating the lateral aspects of his brow, we were able to lift, show more of his eye, so he looks less tired. This procedure is also excellent for women. This woman had already undergone a facelift, but had a heavy brow. And now you can see with her, a more feminine appearing brow has a little bit more of an arch. We want to preserve that arch. With her, we preserve the arch, but we still make her eye look a little bit bigger and brighter. And when that looks bigger and brighter, someone looks less tired. Again, 15-minute treatment that I personally performed at the office. This is another woman. She didn't have the downtime for a bluff. So this is a common thing that I see. Women think, or men think, that they have to cut the skin. Sometimes the issue is not because of redundant skin below our brow. Sometimes it's because we really need to bring the brow up. In a woman, you want the brow to be positioned at least 1 millimeter to 2 millimeters above the bone. In a man, the brow can sit exactly along the bone line, which is right through here. So that's usually the difference between a more feminine brow and a more masculine brow, in addition to the arch. And so with her, after a single therapy treatment, we were able to lift that redundant skin without her having to get a blepharoplasty. Now, it's not just the brow position that can be adjusted with something like ultherapy. Botox or Xeomin and Dysport can also change the position of our brow. And an area that's closely associated with the brow is also the 11s. And so this is an area that both men and women can benefit from. In a man, you don't want it completely, if you're looking for a more masculine look, you don't want it completely frozen. You don't want those 11s completely frozen. For a more feminine looking appearance, yes, you can have that muscle more relaxed than what a man may go for. A man, you still want a little bit more lines and a little bit more movement, unless he's trying to achieve a more feminine looking appearance. But treating this area as well as the tail of the brow is another way to achieve a brow lift. And depending on how much you put where, you can still retain a more horizontally oriented brow for a more masculine appearance, or a more arched brow for a more feminine appearance. Like her, you can see that the ends of her brows are kind of hanging down. And so that makes her look a little older. By putting a little bit at the tail of the brow and in the middle, we have repositioned her brow so that the brow position is a little bit more youthful. And these are millimeters of change. And also by putting a little bit of neuromodulator or Botox underneath her eye now is more open, which is more inviting and is also perceived to be more youthful on first impressions. Again, this woman has that down-shaped brow. Now on her, she not only wanted a quick fix, which neuromodulators can offer, but she also wanted a longer lasting result. So here we combined ultherapy. That's the reason why she looks so taut, and also a little bit of Botox. So with the combination, she has that tautness that you can get from Botox, but her brow has positioned up. You can see her cheeks almost look a little tauter, and that's from ultherapy. Ultherapy is the only device that has a non-surgical indication for lifting of the brows, but also lifting of the skin submentally, or right below the chin. So sometimes we'll offer combination treatments to achieve the results people are looking for. It's not just that one modality can address everything. Now, when we look at the eyes, it's not just everything that's happening from above, it's also what's happening below. And so another area that people commonly are bothered by is the under eye circles, or the hollows. Now, if we look at her, why does she look ideal? Well, you can see her temples go in a little bit more than her cheeks. That's good. She doesn't have any lines or wrinkles in the center that make her look angry, which would make her look a little bit more masculine. Her eyes are nice and wide open, but you can see that she has a little bit of hollowness under the eye. And so she's a great candidate for tear trough filler. So in her, I use Bellatero. That's my product of choice when addressing the tissue immediately underneath the eye. And this is an area that can be injected for both men and women that makes us look a little tired. He had that kind of, now when you start having the fat pads come out a little bit, you don't want to put too much filler underneath the eye, either in a man or in a woman, because it can make the area look even more puffy. It's just, as long as you have the realistic expectation that it'll make it better, but not 100%, that is ideal. If you put too much filler under the eye, you may even masculinize a female, because it will make the middle part of the cheek look flat. And that is more masculine. So sometimes underfilling a little bit under the eye is better, with the trade-off being that you get that the eye still looks a little bit bigger. I commonly see a lot of people come in, they're so overfilled that their eyes almost look small every time they smile. And so now you're actually, you may not have a hollow, but now you in fact just look more masculine and it looks unattractive. So there's a trade-off sometimes, and it's important to understand what that may be. And your injector should be able to help you understand what that may be. Now, not all under eye darkness or hollowness is always caused by volume loss. And I think that's very important. And so I commonly see people just filling this area because that's all that they have is fillers, where the benefit may be from an actually laser. And so we have over 50 lasers and devices in our office. With her, that under eye hollow is actually more caused by the blue vein under her eyes. So in our office, we have the Cool Touch Varia. It's a long pulse 1064 laser. Not all long pulse 1064 lasers should be used to treat these blue veins because they don't have cooling associated with them, which can be harmful, but ours does. And so in a single session, 2 weeks later, you can see that the under eye vein is significantly improved. I generally have seen that patients come in at 2 weeks, we do a complimentary touch-up, and at that point, about 80% success rate 5 years later. So the results last quite a bit of time. She also had a bit of melasma along those lines, pigment, which added even more to the darkness under her eye. Now that we've removed that pigment in blue and have not done anything else, you can see how much brighter and beautiful her eyes are. So with that, now we're going to move on to the cheeks, but I think we do have a poll question for you guys.
Yes, we do. Okay, everyone. So a masculine appearing brow should be straight, arched, or downturned. And then same question for a feminine appearing brow. So input what you think. This is anonymous. No one's judging, but we're gonna see what we know before Dr. Fabi tells us the truth. And just while you guys are filling this in, since I don't have elevator music, I'll remind you that any questions that come up, you're welcome to put in the Q&A feature on Zoom, and we will get to them as soon as Dr. Fabi completes the presentation. All right, I'm going to end this now. Okay, here we go. Interesting.
Okay, so a more masculine appearing brow ideally is straight or horizontally oriented. So 84% of you got it right. And then a more feminine appearing brow, yes, is typically arched. So thank you. Next. And so now we're moving on to the cheeks. And so here you can kind of see that the apple of the cheeks are in the same area for both men and a woman. And actually, this is not ideal if you're either going for a more masculine look or for a more feminine look. And I'll kind of explain why. So this is an example of a female where her cheeks are kind of at the same width as her jawline, coming in for filler. And then this man who has a jawline that is actually a little bit more narrow than his cheeks. And so, you know, what do you do in these kinds of cases? So in a woman like this, you're going to see what I end up doing. And in a man like this, you're going to see what I end up doing. But this is a more masculine appearance for a woman. And he is very masculine, but there is a slight feminization because of his jawline. And so you'll see the opportunity that exists in masculinizing him a little bit more. Now, why is this happening? Why does the face become more bottom heavy in a woman? Ideally in a woman or in a more feminine looking appearing face, you want this more inverted triangle. And that triangle basically inverts as a function of age. And the bottom face gets heavier, whether it's because of jowls, or also because the masseter, this muscle that you use to chew, gets bigger. And so you can continue to chew even if you reduce the size of that muscle. It just doesn't have to be so big, drawing more attention to the bottom aspect of your face. So what can one do? Well, before I start filling, I generally like to first reduce any fat that might be obscuring the jawline in someone, because I have found that if you put filler, whether it's to masculinize or feminize, and the person has a lot of fat along the lower face, you actually end up making them look heavier. And in a female that's trying to preserve her femininity, you may end up actually making her look more masculine. So these are some examples. This is an example of a man who wanted to really preserve his masculinity, wanted jawline filler, but I discouraged him from that and encouraged him to instead reduce that fat and tighten up that skin. And I did that with lipo combined with thermi. And you can see how it almost brought up his jowls a bit. Now, is this a facelift result? No, it is not. But in a man, especially if there's a, most men don't have long hair, you can't really hide the scars of a facelift. And so the options are limited if they want to make the result non-perceptible. So with him, this is him about 3 months later. You can see how just reducing the volume that he had along his lower face and jaw and submental region, neck, he doesn't need as much filler as he would have needed had I started by filling first. And this is true for both men and women. And so here he is now, a year after having reduced that fat. And then on him, I did put a little filler at the back of the jaw, and he just looks stronger, more vibrant, and healthier. And so at that time, I also did a little bit of laser resurfacing to his skin to even out his complexion. So this is to kind of appreciate that now he barely needed any filler when I first reduced the fat that he had. And this is true not just for men, but for women. So with her, by reducing that volume, that excess fat along her lower face and neck, she actually looks a little bit more feminine. And so she came in wanting a little bit of filler into her mid-face and jaw, but that would have made her look more masculine. By reducing the fat, now we accentuate what she always had, which was these beautiful prominent cheekbones. And it just doesn't have to just be fat. Sometimes that excess skin, by tightening it up with thermi or Ultherapy, you can really highlight the jawline that someone has. And so something I've been seeing a lot lately is people just doing a lot of filler and forgetting that we have other devices that can really unmask the volume you already have. And I see that people are using 4 or 5 syringes of the jawline when they already have the volume. So first, reduce the fat and tighten up the skin, because you may not need additional filler. And now if she did filler, she needs a lot less of it, because you'll be able to see it. Now, there are people that are apprehensive about doing lipo in the area, or doing anything invasive. And there are other modalities. Cryolipolysis or cool sculpting is something that we also use in the office. This is after a single session. I did 2 cups. I apply all my own cups in the office. And you can see that she has a nice jawline 8 weeks later, where she actually had gained some weight, but you can still appreciate the reduction in that fat. And so now with this, is this jawline contour as great as that can be achieved with lipo? No, but if it's better than nothing, and she's extremely satisfied. Some people, they may not have as much fat to pinch, or they don't want to sit in the office for an hour to do the cool sculpting. In those cases, you can do Kybella. I've been injecting it since 2012. I was an investigator in the trial. Kybella works great as long as the person that's injecting it knows to assess you to make sure that the fat that you have underneath your chin is truly fat that's above the muscle and not below the muscle. If it's below the muscle, then you're not going to have as great of a result. And so in his case, before we did any type of filler, just reducing that fat makes him look more manly, because you can appreciate his jawline and his chin better. This is after 2 sessions. I space my sessions 3 months apart. In the trial, we did them 1 month apart, but we have found that if you space them out longer, you may need less product with subsequent sessions. The biggest thing after not being assessed properly, another reason why people don't get as great of a result sometimes is because they don't use as much product. And I see people kind of get skimpy on the product. They just do one vial. In the trial, we did an average of 4.4 vials to get the result that we got. So in him, I did 3 vials, and then I did another 3 vials 3 months later. And that's why he has a significant result 3 months after his last treatment. And so I think we have a question at this point, right, Risa?
Yes, we do. Double chin, right?
Mm-hmm.
What is the most effective way to eliminate a double chin? Is it using lipo or liposuction, cool sculpting, or maybe the cool mini, if you know the terms, or Kybella? All right, 5 more seconds. 5, 3, 2, 1. All right.
Okay, so yes, the answer is lipo. That remains the gold standard, but cool sculpting is very effective, specifically the cool mini for fat underneath the chin, as well as Kybella, as long as that fat is over the muscle and you have been assessed for that. We'll go ahead and move on. So once we reduce the fat, whether you're a man or whether you're a woman or whether you're trying to feminize your face or masculinize your face, then we can move on to restoring volume. And how one restores volume along the jawline and the cheek will absolutely participate in either masculinizing or feminizing the face. So in this man, he wanted to masculinize his face. And so I built his jaw. I widened his jaw. If I did this on a woman, I would masculinize her face. And that might be the goal for some. And it's not the goal for the majority of my patients, at least. I did 3 syringes of Radiesse in order to achieve this result. And it lasted a fair amount of time. In the meantime, he kept up with doing a little bit of Xeomin to smoothen out some of the lines along his forehead. And so I always get the question, well, if I start doing this, how long will it last? Well, with him, he came back at 3 years. We did a little bit more. So again, I did some to his jawline and I did a little bit to this lateral aspect of his cheeks, keeping his face wide. So now it's more like that Tom Cruise effect where the width of his cheek is about the same as the width of his jaw. And if you look at him from the back, this is one of the key things where I can always tell, even if you get the proportions right with the width, it's somebody looks at you from multiple angles. We don't have the luxury to look at ourselves from multiple angles, but these are the nuances that kind of flag someone to me, whether they've done something or not. So in a man, the length of that jawline is generally much longer than the lower lip. And so that point at the angle of his mandible is generally much lower than that lower lip. So he's got a longer face. It squares him out from the side as well, so that he has more of a 90-degree angle at the back of his jaw. In a woman, you want more of a 130-degree angle. You want what we call a mandibular sweep. So the way that a jaw is injected to achieve a more masculine looking appearance is different than that for a feminine looking appearance. So here again, you have a shadow. So you build kind of to create where men's hair generally grows. You want to create a step off from the back of his jaw to behind that kind of bone. You want to create that shadow, where in a woman, you necessarily do not want to create that if you're trying to feminize her face. Now, this is what happens when you inject a woman the same way that you would inject a man, and you are trying to masculinize her. So here she has, again, a square back of her mandible. We call it the ramus of the mandible. And so it's more of a 90-degree angle. This makes her, although she has a more defined jawline, it's more masculine appearing. And I'll show you a more feminine appearing jawline in a moment. Now, that woman that I had presented you to earlier, With her, I did put a little bit of filler in her cheek, but in fact, I reduced the size of her lower face so that now the width of her cheek is more prominent and wider than the width of her jaw. And I did that by putting a little bit of Dysport to her masseters. So that shrinks the width of the lower face. And by putting 1 syringe of filler into her cheeks and half of a syringe into her chin, now her chin is not as wide, because if you look at her before, the width of her chin was about as wide as her lips. Now I've made it a little bit pointier, and now it's a little bit more narrow than the width of her mouth. And so these subtle nuances are what make her look a little bit more feminine. Her brow is also now a little bit more arched. And so in her after photo, you don't know exactly what she had done, but you can kind of appreciate that she just looks a little bit more feminine. And it does make her look like her face is a little bit more lifted. Now, that's not to say that you can't inject the jawline and a chin to feminize a face. So in her, unlike that more masculine appearing jaw, her jawline is continuous with her earlobe. We call that a mandibular sweep. And so this is different than the back of a jaw in a man. And so she has a nice jawline that we've recreated. And then I also put a little bit in her chin. And both of these features have now made her look a little bit more feminine. Nothing went into her cheeks. If I had put something into her cheek, I would have made her look wider and flatter. So again, anytime that you're being assessed, it has to be from a 3-dimensional point of view, because you're only seeing yourself the way that you're seeing this patient, but it's in the angles that everybody else sees you. So again, with her, she looks better. She could have a more defined jawline. We could even add more product on her, but 4 cc's of product were needed to achieve this result. So that sometimes you can get a great result, but it may not be perfection. And again, as long as you have that realistic expectation, things can absolutely be accomplished. But again, with her, she doesn't have that strong 90-degree angle at the back of her jaw like we try to achieve with more masculine appearing jaws. Now, if you inject a man the same way that you inject a woman, you can see with him, he had a more 90-degree appearance to the back of his jaw. Now you can see he has more of a mandibular sweep, which is more feminine, and that feminizes his face, which in his case, he was happy with. He wanted a more feminine appearing jawline. Now, in this woman, you can see that she does have a little bit of width to her cheeks, but it's almost 1-to-1 with her jaw. And that makes her look a little bit more masculine. She was complaining about jowling. So with her, you have to be careful. Another thing that I'm commonly seeing is that people just keep injecting their masseters and slimming them and slimming them and slimming them. I did slim down her masseters, but after about 35, you have to be careful with slimming them down, because you are already experiencing some bone loss along your face. So you may have to put a little bit of filler along the cheeks, chin, and the back of the jaw in order to not get some jowling. So with her, I put a little bit into her cheeks, and here she is actually 2 years later, a little into her chin and into the back of the jaw without masculinizing her. And I narrowed out her face by doing a little bit of Botox or masseters. Her under eye area used to look more tired. With her, by putting product in her cheeks, filler in her tear trough, as well as lasering that skin, we were able to soften that transition. Now in a man, when we go into the cheeks, you don't want to add volume out here as much as you want to kind of evenly distribute it along. A man doesn't have a bunch of light reflection just out here in the lateral cheeks like a woman does. And so to keep a masculine face looking masculine, you have to kind of sprinkle it throughout. And that's what we did with him. And he actually looks, even more masculine in his after photo. And, over time, if you do this, do you start looking morphed or weird? Well, this is a beautiful patient of mine. She started out at 31. Today she is 39. And you can see by putting a little bit of product everywhere, retaining those more feminine proportions, which include the chin, the back of the jaw, the cheeks, the brow, the temple. She just looks like a refreshed version of herself, but she still preserves her own unique features. With this woman, again, she has a wider jaw as a function of age, and her whole lower face looks like it's going down. Sometimes by putting Botox into the muscle that pulls the entire face down, which is along the neck, it's called the Nefertiti lift, you can also lift the face. So it's not just putting filler in the cheek or filler in the jaw or reducing the size of the jaw, but it's also relaxing the muscles of the neck that pull the entire neck down, that make the face go up. And so with her, I only needed about 2 syringes of filler into her cheek, jaw, and chin, because the rest of the lift came from relaxing her muscle of her neck, called the platysmal muscle. And so now we're going to be going on to the mouth area, or the perioral area. But I think do we have a question, Risa?
Yes, we do. Do you inject a masculine cheek the same way as a feminine cheek? Do you inject a masculine cheek the same way as a feminine cheek? This one seems like it should be an easy answer. I'm excited to see what Dr. Fabi has to say. All right, 5 more seconds. 5, 4, and don't forget about the Q&A feature. We're almost ready for it. Okay, here we go.
Okay, good. 88% of you said no, and you are right. And so in a man, you kind of want to evenly distribute the filler. In a more feminine face, you would put it out here a little bit more laterally, and you would not put it all in the center, which I commonly see happen in feminine faces, and that can actually be a bit distracting and make the person look a little less attractive. Now, the mouth area is important, just like the eyes and just like the hair, because we had talked about the distance between the nose and the lips is the second factor that someone looks at that can give away the perception of one's age. And in eye tracking studies, the eyes first go to the eyes, and then they go to someone's mouth. So we have to pay attention to this area. And this is a reason why I get a lot of requests for lips, because many people come in and they know that something's off in this area, and they assume it's their lip. And so many of you may know Stephanie. She's my beautiful medical assistant that's been with me now for about 4 years. In the before photo, she's like 26. In the after photo, she's 30. And so you can see that we can actually feminize the face and make it look more attractive with time. And so what did we do for her? Well, she wanted her lips done. But the problem is not the lip. The problem is that her chin, she didn't have a chin to support her lip. So her eye was tracking to the right place. It's just that she doesn't know necessarily the anatomical changes that are happening as a function of age. So she was relying on my expertise to guide her. And so by putting a little bit of filler to her chin, I also did at the same time sculpture to her cheeks. Now she just looks a little softer, and her lips, which she has beautiful lips, now actually are better framed. That's the reason why her lips look bigger, even though nothing was done to her lips. Now, there is no doubt that a small lip, which happens as a function of age, our lip does get smaller, does contribute to a more masculine looking appearance, especially in someone like this who already has a wide face, right? So she already has a wide face, masculine, and now her lips are getting smaller with age, and they're not projecting as much. And so just with 3/4 of a syringe of Restylane, her lips look a little bit fuller, and she just looks a little bit more welcoming and feminine. This is another patient. That width of the face frames the lip. It's not just the chin, but the width of the face. By reducing the width of her face, now her lips look fuller. Think of it like a picture, a 5x7 picture. If you frame it in a frame that's 11x14, that 5x7 picture is going to look smaller. If you frame it in an 8x10 frame, it's going to look bigger. So the masseters, these muscles out here, add width to your face. And if you shrink them a bit, the lip will deceivingly look bigger. On the same day, I put a little bit of filler to her chin, and now she came originally in for her lips, but that's not what she needed. By treating her masseters and her chin, now she looks a little bit more feminine. At the same time, I also opened up her eyes, which we talked about earlier, by bringing her brow 1 to 2 millimeters above her brow bone and opening up her eyeball a little bit. And you can see that she just looks more inviting and more feminine. This is another woman. She came in, and by narrowing out her masseter, it makes her lips look a little bit more pouty. I did put a little bit of filler into her lip, 1 syringe of Juvederm. But as we get older, something that happens is that our maxilla, or the bone right here, and the mandible are resorbing, our teeth are shifting. So I always look at someone's teeth to just make sure, because I see that people want more and more filler. And the problem is that the teeth position, and actually this is something that can even happen in your 20s, depending on the occlusion, your bite. So I commonly, for the people that are on the call and they're my patients, they know that I may even send them to an orthodontist on occasion to basically make their teeth be everted out a little bit so that they can support the lip. So this woman, in her after photo, she did not have filler, but she actually had dentures. So by giving her dentures, this is just to illustrate the power of teeth and teeth position. If you position the teeth in the right place, you can improve not just only the lines around the mouth, but also make the lip look more voluminous, improve the marionette lines, and even the nasolabial folds. So the answer is not always filler. Now, I like to think and talk about the age-appropriate lip. The lip that is found on a 20-year-old is not the lip that we exactly want to find on a 60-year-old. And in my beautiful patient, after augmentation of her full face, I sometimes tell my patients, and for those who are on my call, I'll sometimes say, I'm going to have to eventually do something to your lip, because if your whole face is volumized and it looks beautiful and natural, if the lip is too small, something's off and it still makes you look masculine. So by adding a little bit of volume, but that's age appropriate, now her lip matches the volumization done to the entire rest of her face. And she doesn't look as angry. But what really brings a lot of women in are these lines, these perioral lines. And we don't see these as much in men because the skin around the lip in a woman is about 30% thinner than that of their male counterpart. And so some of my colleagues joke that sometimes it's because we speak have 10,000 more words to say on average in a day than a man. But I'd like to think it's because we just don't have as thick of skin in this area. And we don't have any hair to protect that area from UVA and UVB. And so this is an area where you can find a lot of people start looking weird when they only chase the lines over their lip. You have to be able to put a little bit of product along the border of the lip to support the volume of the body of the lip and support the muscle that's creating those lines. So with her, using half of a syringe along the border of her lip and then half of the syringe into the lines, soften the lines. The rest would have to be done with laser resurfacing. So this is another area where I commonly see issues, is that people are trying to achieve it all with filler because it's easy to get your hands on filler, or people don't want to give the downtime for a laser, or your injector doesn't have the laser to get rid of the lines. That's never a good reason not to do the right thing for the problem that you're bothered by. And so with her, it would be laser resurfacing to address the rest of her lines. And so, Risa, do we have a question before I finish up with relaxing?
We do. We have the skin one.
Okay.
So last poll for the day: is reducing the size of the face as equally as important as adding volume to the face? So is reducing the size of the face as just as important as adding volume to the face? It's kind of a tricky question. All right, 5 more seconds. 5, 4, 3, 2.
Yay. Okay. So yes, for those who answered yes, it is. You're right, and I know that that's what we've been talking about. I know 14% of you said maybe. I think maybe is if it depends on the face, of course. But I think that what we're really trying to stress is that just because fillers are more accessible, people tend to go to them first, where they may find is equal value in reducing the volume that they have with fat reducing modalities, or by using neuromodulators like Botox, Dysport, Xeomin to reduce the size of the muscles, whether they're the masseter muscles along the lower face, or by reducing or relaxing the platysmal muscle that's pulling on the corners of the mouth. And so this is a man who was bothered by his acne scars, but they only were accentuated when he smiled. And this accordion effect we see also both in men and women. And a common area where, again, I see people just filling in the lines, and that's not the right thing to do, regardless of whether you're feminizing or masculinizing the face, because it'll make this area look heavy. And so in fact, his lines were reduced. You can kind of see in the bottom third photo by just doing a little bit of Botox to the muscle. This beautiful woman came in wanting to reduce or do like lipo or Kybella to this area, this double chin. But in fact, what was adding width to her face and making it look heavier was not just her masseters, but also her platysma. So by reducing the size of her masseters and relaxing her platysma, the width of her face looks thinner. Your eye looks like it's going up to her cheeks, which is what you're trying to achieve in a more feminine appearing face. And her neck looks a bit thinner. And so, again, another, beautiful woman, she already has good cheek volume. So we don't want to add more volume into her cheeks by just reducing the width of her face and relaxing the muscle that pulls on the corner of her mouth. Her face looks like it goes up, and she just looks like a younger version, like her younger sister. Again, many people come in, both men and women, and are bothered by these accordion lines. By relaxing the muscles of the neck, you actually get improvement in these lines, and you don't have to add filler. And over time, you can absolutely have shifts in the face. This beautiful 50-year-old today started with me at 42, not having to do much. She does very little, but the goal of these aesthetic procedures in her is to just keep her looking a bit more feminine. And that's what we've done. So it's not that she just necessarily looks younger, it's just that she looks more feminine. And so I'm going to finish up with the skin, because sometimes I see in my practice different goals depending on someone is trying to achieve a more feminine looking appearance or a masculine looking appearance. I find that acne and acne scarring are probably, after fat reducing of the neck and the body, probably the third most common thing that men come into the office for. And so the biggest thing is to address the acne when you see it. So it's never a bad idea to be aggressive with treating your acne, because acne scars are extremely hard to improve, although you can improve them. And the younger you are when you address those acne scars, the better the result I have typically seen. So this young boy came in. I did a photodynamic therapy session. In our office, we used 4 different lasers and light sources to do for PDT. And then I did a session for his acne scars, and here he is 6 months later. So I see that this is something that bothers both men and women equally, and improving it helps preserve your masculinity or femininity equally. In men, I do tend to see more significant body acne, and definitely an area where you want to aggressively treat again, because treating off of the face for acne scars is even harder than on the face. So this is him, 1 treatment with photodynamic therapy, 2 months later. In this beautiful female, you can see how much more you can appreciate her feminine features when you improve her acne. So sometimes acne actually distracts us from the feminine features that she already has: a beautiful cheek, a beautiful lip, beautiful eyes. And here she is after 1 PDT, and then we did Fraxel Restores to improve her acne scarring. Now with more clear skin, she looks more feminine. But it's not just acneiform lesions that participate in distracting us from the more masculine or feminine features. It's also pigment. Pigment issues can make someone look on average about 5 years older. So if you take this beautiful face to your right and you added all that pigment, you could technically make her look about 5 years older. And so this is an issue that I usually treat more in women than I do in men. And so this is after a single IPL procedure. Melasma is a condition that we tend to see more in women, although 10% of men can have melasma. This is hormonally induced, much trickier and harder to treat. There is no cure. It's just finding that right modality that you can maintain it with. And so with her, we used a Fraxel dual, which in trials in our practice, we have found can improve melasma up to 60 to 80% in a month after a single treatment, but the melasma will want to come back. So you have to maintain with something every 6 months. But you can see that when you improve that pigment, in her, I did a combination of pulsed dye laser or a V-beam because she had some redness and Fraxel. She just looks more feminine. When you clean up that dyschromia, that pigment and that redness, you can appreciate her more feminine features. And here she is looking just a little bit more glowy after 2 weeks from a single treatment. But men do these procedures too. This is one of my associates. He's an avid cycler. All that pigment gives appearance of more dull, lusterless skin. And so with him, after a fractionated CO2, we were able to really bring a little bit more evenness to his skin, making him look healthier. So interestingly, pigment and redness are associated with making people look unhealthy. When you remove it, you make someone look healthier. And there are, again, studies to support that, specifically by Bernard Fink, for those who are nerds like me and want to go look this up. Wrinkles that add to textural changes make someone look older generally, up to 10 years older. And so pigment and redness, a function more of health. Wrinkles and texture function more of age. And we also have precancerous lesions, whether you're a man or you're a woman. These are things that can bother both and definitely should be treated because there's about an 8% chance that they can progress to become a skin cancer. In our office, again, we use photodynamic therapy using our 4 different lasers and lights that we do. And so you can see with him, by cleaning up his redness and his pigment, you can appreciate more of his features, his stronger jaw, his more horizontal brow. And so clean skin is good in both those that are trying to maintain masculinity or femininity. But I'd say that with wrinkles, you don't necessarily want to efface all of them if you are trying to achieve a more masculine look. Some are usually associated with more masculine features. And that's why I showed you that photo of Tom Cruise. And if you look at magazines, I challenge you to go look at magazines, you will see that more masculine appearing men tend to have a little bit more texture to their skin and have more wrinkles. But in a woman who's trying to achieve a more feminine looking appearance, she generally does want less wrinkles and more of a glow. And so you can see with her 4 years later how much she looks even more youthful than when she started with me. And this is by doing fully ablative CO2 resurfacing. Again, this woman, by removing that dullness to her skin, improving the texture and improving the wrinkles, she looks much more youthful and more feminine. And you lose some of the masculinity she had, even though I did not do any filler on her. And with her, again, she just looks softer and more feminine by improving the texture, the blueness of the vein underneath her eye, and her wrinkles. And I'm going to leave it with hair. Hair is an issue that participates in a more masculine looking appearance and also a more feminine looking appearance. On average, women start to lose their hair density at about 27. Their peak in their hair density is at the age of 27. Men lose hair generally more from genetic components. But there's no doubt that there's an industry now with all these hair extensions because this woman is the same woman, but she looks like her 20-year younger self in the after photo. The issue with these extensions is that they can be damaging to the hair, and we commonly see a lot of women coming in because of the traction that these extensions have. They start to pull on the hair follicle, which can cause damage to the hair follicle. So we do a lot of PRP, and that is something that is as popular in women in my office as it is in men. And you can see all of these images, how much more younger the woman in the after looks like when you increase that hair density. And so with that, I thank you for your attention. I'm sorry about 4 minutes behind, but definitely want to take some of your questions.
Great. Thank you so much, Dr. Fabi. That was amazing. There are a number of questions here, but we'll get through them as quickly as possible. If some of you have to run, remember we are recording this, so we'll share it later. And if for those of you that may have joined after I said, please, if you have any questions now, you can add them to the Q&A feature in Zoom. So here's a good one. Do you recommend clients come in free of makeup on the day of their consultation? And typically, if someone comes in with general issues, as the doctor, will you give suggestions as far as a treatment plan goes?
Yes, so we all know that you guys are obviously busy, and so sometimes it's hard to come in with no makeup because you're, going to work, or you're coming from work, or you're coming from something else. But in an ideal situation, yes, it's great to have you come in with no makeup, and I actually almost encourage it now with masks to prevent maskne. And for those that do see me in my practice, you'll know that I generally do make global recommendations. Sometimes if we don't, we ask you, obviously, is it okay if I make recommendations? We aren't pushy about those recommendations because some people will take offense as if we're trying to highlight things that they're not bothered by. So it really depends on the individual and how open they are. And if they tell us, please feel free to say anything else. Some people come in and they're just bothered with one brown spot and that's all they want to talk about. And it's none of my business if they're not bothered by anything else, and I have to honor people and their desires and their wishes. So if you want a full consultation, then definitely make that clear to us when you book the consultation.
Great insight, Lisa. Thank you so much. All right. What type of treatments do you recommend for under eye wrinkles? And if a laser, which type?
For under eye wrinkles, there are two things that are adding to the issue. Well, why do we even have under eye wrinkles? Your bone is resorbing, so you're losing bone. Your muscle no longer can sit on that bone, so it's contracting, making you look like you're squinting. You can look at your photos and that will show you evidence. So sometimes you need to add a little bit of volume to support that muscle along the cheek, and then you have to relax that muscle with a little bit of Botox. Any residual skin that's left over, I like to use laser resurfacing, specifically with a fully ablative CO2, not a fractionated CO2. A fully ablative CO2 is the gold standard for really tightening up that skin and stimulating new collagen. That's the thinnest skin of your entire body. And as you age, it makes us look older because it's next to much thicker, more youthful appearing cheek skin.
Great. So this one, they said, very informational. I believe it is beneficial to go to someone experienced in injecting Botox to get these looks. I never knew you could achieve with just injections.
Oh, absolutely. You can reshape the entire face with just Botox. And I think that that's a trick. I use it on myself so that I don't have to rely heavily on filler, and in that way, I kind of preserve my own unique features. So you definitely need to go to someone who uses a lot of Botox to reshape the face.
All right. Typically, how much Botox or Dysport do you need in the masseters to reduce the bulk?
That's a great question. So I actually just completed one of the clinical trials for Botox, but in the trials that have been done, when they did a study looking at 10 units on each side, it was not a significant result. The study was done by Carruthers, my mentor. When she did 20 units on each side, that's when you started to see a significant result, and 30 units was even better. So in my practice, I usually do probably a minimum of 12 units on each side. It's the largest muscle of your entire face. So if you don't put enough in, it's kind of like throwing water in the ocean. And Depending on the size, sometimes you may need up to about 18 to 20 units on each side, just like Jean showed in her paper. The nice thing about it is that after the second treatment, which you can do as early as 4 to 6 months later, I see that the results last almost 6 months. And if you've done it 3 or 4 times, you can even go maybe 6 to 8 months.
Wow. I know it's one of my favorite treatments.
And it also releases that tension that many of us have and that we hold in our face.
Yeah, after I get it done, people ask me if I've lost weight. It's my favorite.
Exactly.
Best little trick. All right. Can cheek filler help the lower face, like lower cheeks and nasal labial area? Or
That's a great question too. Yes, it can improve it, but I think that people, as with everything, have gone too far and only put cheek filler in an attempt to lift the whole face. And that's probably not a good idea. So yes, will it help it? For sure, but you shouldn't be relying only on filler to lift your nasolabial folds and your marionettes. There are other things like threads and therapy and doing Botox to the lower face that can help with lifting those areas as well. And it's typically a combination of those things that can give you the most natural looking results.
All right, a few more if they're still coming in. You tell us when you need to stop. Also, what is the best procedure for a skinny neck with horizontal lines and a little bit of a turkey neck?
I think that that's something that probably needs to be evaluated. Horizontal lines are very difficult. Botox has been found, again, by Jean Carruthers, to improve the appearance of those lines partially. And then I do filler in them once I've relaxed the muscle with a little bit of Bellatero to soften it even more. In the turkey neck, it depends if it's fat, then lipo. If it's just skin, then all therapy.
All right. This is a good one. How safe is it to come in for an evaluation with COVID right now?
You are more than welcome to actually do a virtual consultation. And we're doing that and offering that in our office.
And if you do come in, we are following all of the COVID safety guidelines to the fullest extent. So we are trying to make it as safe as possible. All right, I am a 51-year-old female with lots of sun damage and pigmentation. I've never had any cosmetic procedures. Should I take care of my sun damage before doing other things like fillers and Botox?
Yeah, we've actually found that if your face is covered with pigmentation and redness, sometimes you can't even appreciate the results of lifting the skin or even the volume that the filler may offer you because it's still covered with brown spots and redness. So if you're saying that you have a lot of sun damage, addressing the pigmentation wouldn't be a bad thing to do first.
Okay, are these principles of masculinity and femininity something that most dermatologists share? Do they share similar opinions on what a person needs to achieve a more feminine look, or does it really differ from doctor to doctor?
Well, there's the 5 formula. I mean, these are concepts that have been published on. So I think it just really depends on how up to date your doctor is on what's been lectured on and published on in the current literature.
All right. Do you treat acne ice pick scars with TCA Cross?
I personally do not. I have in the past. That's how I trained, was using TCA Cross. And I refer to one of my esteemed colleagues if that is truly the case, that does not practice in our practice.
What is the best laser for skin tightening?
Well, it depends on if it's true heaviness. The only device that has an FDA clearance to lift the skin is Ultherapy for both the brow and the skin underneath the chin. If it's true superficial crepiness, like that extra lax skin underneath the eye, then it's CO2 laser.
Aside from the masseters, where else can you inject Botox in the lower face?
Oh, we have the orbicularis oris, the DAO, the mentalis, the platysma. There are different muscles that you can definitely treat. But the lower face is a more advanced area. And so I commonly even have people that go to somebody and for their upper face and then come to me for their lower face because they've had speech problems and other issues because someone else treated their lower face.
Only a few more. Can Ultherapy help with facial asymmetry if one eye hood is more noticeable than the other?
It depends why one has the facial asymmetry. Is it bone loss? Because all therapy cannot stimulate bone. Is it muscle that's no longer has the bone to lay onto? In that case, probably Botox would do a better job correcting the asymmetry. We have to determine why. And so that just requires an assessment.
Okay. And let's see, will Fraxel be okay for someone with darker skin?
It depends on the Fraxel. So I always liken Fraxel to kind of Coca-Cola. Coca-Cola has many different brands under it, whether it's Coke Zero, Sprite, or Fanta. And so there's Fraxel Dual, there's Fraxel Restore, and there's Fraxel Repair. It depends on the color of the skin. In our practice, we commonly do the Fraxel Dual on Fitzpatrick skin types 4s and 5s, and even Fraxel Repairs on Fitzpatrick skin types 4s, with the realistic expectations that you may temporarily pigment. And that pigment is temporary, and then we can improve it, but it all depends on the setting. So it's a very customized question depending on your skin type and what the issue may be.
Okay, thank you so much. I know there are still some questions left, but we do have to wrap this up. So I want to encourage you to please follow us on social media, follow Dr. Fabi on social media. Please send your questions over DM. You can also email us on our website and we'll do our best. And of course, the best option is to schedule a consultation with Dr. Fabi, either virtually or in the office, or any of our esteemed dermatologists or medical esthetician. So Dr. Fabi, thank you so much for your time today. This was amazing.
Thank you so much, Risa. And then as far as the raffle is concerned, are you going to just choose from the person that, and we'll reach out to them directly, or how do you want to do that?
Yes, thank you so much. I almost forgot. So a lot of people attended today's webinar. We are going to pick someone and we will announce it by the end of the day tomorrow. And one of you is going to win 20 units of Botox that you can use in the next 2 weeks. So we will be sending out that notification tomorrow. And so thank you so much for tuning in. I really hope this was useful and educational. And
thank you everyone for taking time out of your day today. And we appreciate you. And for my patients that are on the call, I look forward to seeing you all soon. Bye, guys.
Thank you so much, Dr. Fabi. Bye.